Hello again, and welcome to another episode of Sexual Health and You. Today we are going to talk about STIs. Alright, so let's talk about STIs. So, what are they and why are they important, you ask? Well, STIs are sexually transmitted infections that can affect general health, well-being, and reproduction of those who may be infected by an STI. So, the first one we're going to talk about is chlamydia. And chlamydia, according to the Public Health Agency of Canada, is contracted through the spreading of the bacteria Chlamydia trachomatis. It can be spread via anal, vaginal, and oral sex without the use of a condom or dental dam. Signs and symptoms can include discharge, burning while peeing, vaginal bleeding in women, pain or swelling in the testes in males, and pain during sex. But it can also be asymptomatic, meaning that no symptoms are present, which makes it hard to diagnose. So here's a quick fact for you. Chlamydia is the most commonly reported STI among Canadians. It is more dominant in the youth and young adult population, especially in women ages 15 to 24. We got this fact from HealthLink BC. So in this image we have two different pictures. The one on the left is a normal cervix of a woman, and the one on the right is a cervix that has been infected with chlamydia. And as you can see, it is very red and inflamed. Moving on, we have genital herpes, which are a common sexually transmitted disease that any sexually active person can get. There are two types, herpes simplex virus type 1 and herpes simplex virus type 2. Herpes simplex virus type 1 is oral herpes, and oral herpes, which could be cold sores or fever blisters around the mouth, may be contracted through non-sexual contact with saliva, such as sharing drinks, but it can also be passed on the mouth to the genitals during oral sex. And then herpes simplex virus type 2, genital herpes can be contracted through oral and anal and vaginal sex, and there's no cure for herpes. Some signs and symptoms include tender lumps in the groin and sores on or inside the vagina or penis, around or near the anus, or on the thigh or buttocks. And this information was obtained by the Public Health Agency of Canada. Fun fact number 2 coming at you from HealthLink BC, genital herpes infection affects women more than men. This infection is common in teen and adult women and men. Alright, so this image shows a child with herpes simplex virus type 1. As you can see, it's on the face and it is very red and inflamed and looks very painful. Next, we have gonorrhea. As described by the BC Centre for Disease Control, it's a bacterial infection in urethra of men and urethra cervix are both in women. It can also affect the rectum, anus, throat, pelvic organs, and in rare cases, the membrane that lines the eyelid and the eye surface. Commonly, gonorrhea, you don't have any symptoms, but it could include painful peeing, anal itching or bleeding, and a normal discharge from the genital area. Fun fact number 3, gonorrhea has increased by 94% over the past 10 years. Men account for 2/3 of reported cases. Young men ages 20 to 29 and young women ages 15 to 24 are most affected. So here we have different pictures of symptoms of gonorrhea patients. You can see gonorrhea in the mouth, on the finger, on the back, and on the eyelids. Next, we have HPV, also known as the human papillomavirus. It is one of the most common STIs in Canada and worldwide. According to the Public Health Agency of Canada, they also state many types of HPV have been identified, with some leading to cancer and other skin lesions such as anogenital warts. There is no cure, but symptoms are treatable. Practicing safer sex reduces the chances, and routine pap testing for women is important screening tools for cervical cancer and allows for early stage treatment. Usually there are no symptoms, but you may possibly see the anogenital warts either on or inside the genitals. And another fun fact, about 70% of adults will have had genital types of HPV at least once in their lifetimes. And that's another one from HealthLink BC. And here you can see an HPV oral cancer that has started in the mouth. And next we move on to LGV, also known as lymphomal granuloma varium. This is caused by rare and aggressive strains of bacteria that cause chlamydia, according to Public Health Agency of Canada. They also say some signs and symptoms are painless sore or lump that will develop in about 3 to 30 days after being infected. And then flu-like symptoms are experienced, such as mild fever, chills, fatigue, muscle and joint aches. This is an STI on the rise in Canada, and approximately 30 cases per year have been reported in the past couple of years, with most cases involving men having unprotected sex with men, according to the Public Health Agency of Canada. And here we have a picture of LGV in the groin of a male there. And next we have syphilis. So syphilis, according to the BC Centre for Disease Control, is caused by the bacterium Treponema pallidum. It occurs in stages, with each stage associated with different symptoms. It alternates between times it's active and times it's inactive. Some symptoms include painless sores developing in the mouth, genital, and anal area. Skin rash may appear, and this disease actually appears like other diseases, and it is really hard to actually detect in somebody. Fun fact number 6 here coming at you from HealthLink BC. Syphilis rates across Canada in the past 15 years have increased, and men ages 30 to 39 who have sex with men and sex workers are most affected. And here you can see a skin rash located on a client with syphilis. And lastly, we have HIV and AIDS, also known as the human immunodeficiency viruses and acquired immunodeficiency syndrome, respectively. According to the BC Centre for Disease Control, HIV is a virus that attacks the immune system, and without a strong immune system, your body is unable to fight off other diseases. Without treatment, HIV will develop into AIDS. However, if treatment is received, people diagnosed may take 10 to 12 years to develop AIDS, sometimes HIV not developing into AIDS at all. People with HIV can live long, healthy lives with treatment. Some common signs and symptoms are fever, sore throat, headache, muscle ache and joint pain, swollen glands, and a skin rash. However, in the early stages, there are usually no symptoms that are occurring. The last fun fact here from HealthLink BC, there was a 20% rise in HIV positive test reports between 2000 and 2004. It's more common in injection drug users, men who have sex with men, and young women ages 15 to 19. And here you can see that there is a rash here on a patient's forehead. Alright, now we're going to move on to some quick tips for STI prevention obtained by Canada Health. First tip, limit your sexual partners. The less sexual partners you have, the less opportunity you will have to get an STI. Second, use a male or female condom. Using a male or female condom helps prevent from getting STIs, certain STIs anyways, and it can also help in preventing pregnancy from occurring. Big bonus there. Next, carefully wash genitals after sex, so we want to make sure that we clean up. Number 1, it's more sanitary that way, and number 2, it helps prevent STIs from being contracted. Then, if you think you're infected, please avoid having sex and get tested. We do not want to spread infection. And if you are infected, please notify all sexual contacts so they can be tested and treated, so that they're not passing on more to others. Thanks for watching our final episode of Sexual Health and You on STI prevention. And again, if you need any resources, you can always access them at the Kamloops Youth Clinic, located at 519 Columbia Street in Kamloops, BC. They offer condoms, birth control, pregnancy testing, counseling, emergency contraception, and HIV testing referral. You can also go get tested at your family doctor or any walk-in clinic, as well as online. Lab testing forms to screen for STIs are available at www.getcheckedonline.com. Remember, get tested often to help prevent the spread of infection.